This is Steve Parker of Sports Med Central and Elite Therapy Solutions of Richardson, Texas. Today we're going to talk about mobilizing your disc in your back. Most people at some time in their life will have some kind of disc problem. Because of this, we need to identify it either through MRIs, CAT scans, something to identify where you're having the disc problem. One of the symptoms is pain down one leg or the other. Identifying the nerve root is nice. Once you figure out which side the pain is going down, this will tell us how to treat the disc. Now we'll go to my assistant and we're going to do some disc mobilization. Okay. We lean to one side, and if say the pain's down the right side, that should make the pain worse. We go to the left side, that should make the pain better because it's separating the vertebrae in the back. Leaning backwards, the pain should get bad again. This tells us that the bulge is out the right and out the back at the same time. Rarely does a bulge come out the front because of the structures in the back. Now we're going to lean into the pain, and we're going to start milking the nuclei of the disc back into the disc space. So we're going to lean into it, taking the stress off the nerve root, because right now the annulus is getting pushed up against the nerve root by the nuclei. And we're leaning into it, and slowly it'll feel bad, and it'll start getting better and better, and eventually the pain will come up out of your leg, and it will centralize in your low back. Now there's another way of doing it. I wouldn't suggest this at home. This is something we do in the clinical setting. Let me adjust the camera a little bit, and it's a way of getting some traction in the low back. As you mobilize the disc, the nuclei of the disc back into its space, and see I'll lift and bend at the same time, and get it pretty good. And lifting it up will separate the vertebrae, which will give it a easier glide back into the disc space. And sometimes it takes a lot of pull. And you got to really lift up and lean, and actually leaning over and lifting up at the same time actually opens up that disc space, so the vertebrae themselves will actually push the nuclei of the disc back to where it's supposed to go. And then I'll put them on their elbows. At this point, the pain in the back is centralized to the low back, and I put them on their elbows, and sometimes I'll put them there for 2 or 3 minutes, because this can be painful as well. And when the pain starts to subside, I'll have them do light press-ups, and they go up and down. And once again, we're milking the nuclei, which is pushed out pushed out up against the annulus, against the nerve root. We're pushing the annulus and the nuclei back, centralized into the disc space. And as the pain gets less and less with each movement, she can go higher and higher, and then you get to a point where you just go back up on your elbows again and rest there, and this helps hold it in. So we sit there and rest, and it holds it in, and then eventually, after we get this all the pain gone, then we can start some core strengthening, keeping in mind that we want to keep the back in a neutral position so we don't push the disc out once again. Now she's going to go and push up one more time, I believe, because once we've been up for a while, and then she's going to push up and do it again. In a clinical situation, I will actually get up on a stool and put my hands on her sacrum and give her some back pressure, especially in some of the harder cases, and that will help facilitate moving the disc material back to where it's supposed to be. But it's important to get a correct diagnosis from either your orthopedic or your physical therapist before you attempt any of these procedures.